Good morning, everybody, and thank you that we are happy that we can also present our point of view to regarding artificial intelligence doctors and the use of artificial intelligence in the medical diagnosis. We start to present you the technology, what is artificial intelligence, what is state of the art, and any future developments. And afterwards, we are happy to provide you with some legal issues, legal impacts, specifically privacy issues involved, but also regulatory issues and even other questions and deliberations.
Right, so good morning from my side as well. Taking over to just briefly try to sum up first from the technological perspective what we are going to be talking about, and this will of course in no way be exhaustive or final, especially since after our research the results or the situation, the practice has shown that there is no real definition of an AI in this context. Anyway, there are various definitions, some of which you can see on the screen. In practice, what we have assessed for the purpose of this presentation and what we'll be talking about are problem-solving algorithms which use large amounts of data, so the big data applications, but also have the possibility to improve and learn from their own data processing. So these will be roughly the systems we have in mind. As concerns the present situation, our research has resulted in some very interesting results, namely that there are already tools which have been approved, especially in the United States, which can provide some very sophisticated diagnostic assessments and which equate or even outperform medical doctors. I have found, or we have found, multiple entries or reports that, especially in cases of cancer diagnostics, there are systems which already outperform medical doctors. As concerns the future, well, difficult to predict, of course, but I suppose only the sky's the limit. The systems will definitely improve. We have seen that in the past. Possibly we are even looking forward to systems which are completely autonomous, like true artificial intelligence we know from science fiction. In the near future, these will probably be the systems with some limited autonomy, but more robust and more enhanced diagnostic abilities, also including possibly some real-time monitoring systems which collect data from patients in real time and then provide diagnostics. With that, we can go to the core of our presentation, namely the legal issues, and back to Sabine for a brief overview over which we're going to be talking about.
Yeah. In fact, artificial intelligence is at present not really explicitly regulated. That means so until now we have just to apply the existing legal system to artificial intelligence and have to work with that. So, and the main issues that arise are, of course, data protection issues, privacy issues, but also very important regulatory issues, like, for example, in Austria, and I assume in many other countries, we have doctors' privilege of doctors to make diagnosis and treatment that cannot be replaced by a machine. But we also have regulatory issues relating to admission of artificial licensing of artificial intelligence systems in Austria, for example, under the Medical Products Act. We have liability issues that are still quite open and unsolved, but also questions: who owns the data, who owns the artificial intelligence? So many things are open, and specifically, we even expect that maybe new legal systems will be introduced, also driven by the specific situation at the moment to the pandemic. So I hand over again to Stefan, who presents the data privacy issues.
Thank you, Sabine. So going to the data protection part, which is, if not the central, then certainly one of the central questions when talking about algorithms and AI, especially in the health sector, and also kind of the topic of the conference. There are various issues arising here, and we will not be going into that much detail, but rather present a kind of bird's eye view on possible issues arising from the GDPR. So first, the obvious topic: how can patients' data be processed lawfully, so collect and process lawfully in the first place? In our experience dealing with the first AI systems we have been confronted with, there are two distinct issues here. On one side, the processing of data for the main purpose of the AI, in this case, collecting and processing for the diagnosis in a specific case. But then also beyond that, the AI lives and breathes on data, and just like humans, it gets better by practice. So in order to air quotes train it, you need a large amount of data for the AI to actually get better. So in this section, there is also a question or an issue: how can this data processing be done in a lawful manner? What are the sources of the data? Can the data from the first use case, namely the diagnosis, be used for the training as well? Under which requirements? Or can the AI even tap in some broader networks, taking larger amounts of data to actually be able to learn? Going to the first issue, the first matter. On a first glance, this is basically same or similar as the situation we have in the present when a patient is diagnosed by a medical doctor. So in that case, the doctor obviously also has to use patient's data as well. But looking more deeply, there are limitations in the GDPR which could limit the diagnosis even on this level by an AI. Both the letter H, which provides a legal basis for use for sensitive data for medical occupation diagnostic purposes, as well as the paragraph 3 of the same provision, limit or apparently limit this use of data actually to occupational medicine, respectively, to use by professionals. So already here we have the question whether the GDPR actually limits the use of data in this respect to use by medical professionals only. We'll be coming to this topic again concerning the regulatory issues. This is a question with which we have been confronted in the practice in other contexts as well. So I dare to say that in this particular respect, the GDPR is probably too restrictive and may need amending as it is anyway, and also for the future developments. Otherwise, there is of course always the possibility of obtaining a patient consent, but as always under the GDPR, a consent is usually very difficult to obtain. There are strict transparency requirements, other requirements, and in practice, it is usually recommendable not to rely on consent if possible, to rely on another legal basis. But going beyond the diagnosis, we actually have the other topic, namely the use of data for training purposes. In this case, the question is raised whether the data of diagnosed patient can be used for training as well. The question whether this change of purpose will be permissible, and under which rules, and even if the GDPR provides a possibility for a change of purpose in this respect. A side note, a change of purpose in the GDPR is explicitly regulated in Article 6 for the non-sensitive data, but not in Article 9. Other questions, whether the data from other sources can be used. Here in practice, and we have been confronted in other cases with this question already, the go-to solution was definitely to obtain consent. We have never been really able to find another solution which was legally sound and reliable, in the sense that it would be advisable to rely on it. As already mentioned, there are some in the previous presentation. This is a question which also is raised in case of use of data for research purposes. In Austria, for example, there are some legal bases in that respect, but it is very questionable whether training of an AI can be interpreted or classified as research. So again, in this respect, consent would probably be the fallback solution at the moment, at least. Another possible solution could be the anonymization, but in practice, at least, this was always presented with considerable technical difficulties to achieve full anonymization, at least if the GDPR is interpreted strictly in this respect. And then going beyond the lawfulness, just to skim on other two interesting topics, the international data transfers. This is not specific to data use in AI solutions, but it is also an aspect thereof. Whenever we have a big data and machine learning applications, they usually or often involve cloud solutions, which again, usually or often involve data transfers, basically worldwide. This is not a new topic, but its importance has increased severely now in the post-Schrems 2 era. But again, this is not an issue which is specific to AI solutions, and it's a problem which is acute and which is being dealt with by practitioners already. We have also had some legal developments or possible solutions in that respect. So this will be a topic which will be addressed shortly, or is being addressed in the moment anyway. But just to keep in mind also for the AI solutions, could be an issue in the future as well. And then last but not least, just to mention very briefly data security. In this respect, in particular, since the data in question are Article 9 data, air quote, sensitive data, there will be so the data security requirements will be high. Additional data security requirements may or would likely apply as well. But in this particular respect, I dare to say that the question of the personal data security in particular might be consumed by the broader issue of cybersecurity and system security as well. Because here we do not just have the personal data that could be threatened, but also the entire algorithm. And I dare to say a personal data breach, in particular involving sensitive data, Article 9 data, health-related data, is bad enough. But if a doctor solution, an AI solution, which provides a real-time diagnosis, is hacked and the results are actually influenced by an outside party, this could be even worse. So again, I dare to say that the cybersecurity and the data security considerations here would actually be much broader than just personal data security. And with that, I can finalize my brief overview of the data privacy issue and can give back to Sabine, considering the regulatory questions.
Yeah. The profession of the medical doctors is heavily regulated, specifically in Austria by the Medical Doctors Act, and it basically says that any kind of examination, medical assessment, diagnosis, and treatment is completely reserved to the medical profession, to the doctors, but this also means that treatment diagnosis cannot be done by a machine, cannot be replaced by a machine. And specifically, there is also a second requirement, the principle of directness and personal examination, which means that the doctors have to have direct contact with the patient, and whenever the physical contact between doctor and patient is necessary, not having this contact is a regulatory infringement of the Doctors Act, and actually this requirement has already been assessed now during the pandemic, as where we saw that it can be interpreted often quite leniently. For example, by the meeting of the patient by means of telecommunications was examined as not an infringement of this principle of directness and personal examination. Specifically, it was shown because such meetings of patients were reimbursed by the social insurance systems. But having said that, the medical regulatory profession has to be very, very strict in complying, and specifically the use of algorithms by persons other than doctors has to be considered very strictly. Just maybe kind of assistance services like feeding the system with data, but any kind of evaluation of data is in the strict sphere of the doctors, of the medical profession. Another regulatory issue is the regulated medical products. The artificial intelligence tools are most likely all subject to the Medical Products Act, meaning that they have to be admitted to a specific procedures, and also complying with many obligations, being specific safety requirements, the prior clinical trials, but also the producers and the traders of such systems need a qualified trade license. And it has to be noted, when using and applying this artificial intelligence systems, so far they are not subject to any kind of ethical questions. They are not considered in the deliberation to use them. The only area where ethical issues are considered is during the clinical trials, where as the clinical trials have also to be presented to the ethical commission, and where ethical issues are then considered. Well, in the end, other aspects that have to be considered, like black box issues. In reality, we do not really know what are the methods, what are the algorithms behind any systems, because this is usually a trade secret, not disclosed by the developers or producers of artificial intelligence. And thus meaning, on the other hand, it's very difficult to find mistakes, to evaluate mistakes, which leads to the next issue, the liability. Who is liable for mistakes of the system? Is it the programmer, or is it the operator, or are both liable? The issue arises, is this a case of product liability? Is this a case that artificial intelligence as such is dangerous thing. So issues are still open. And of course, if there are mistakes in the programming, the programmer can be liable. But most probably also the doctor, also the operator can be found liable if he, in his general use of the system and general evaluation, diagnosis, completely relies on the system and does not really consider that there might be obvious mistakes. So in the end, most probably program and operator are liable, but very much depending on the situation as such. So here things are still quite open for the future, and also for, on the one hand, maybe legislator, but also open to the court decisions. And last but not least, finally, some considerations is will the use of artificial intelligence be subject to patient's consent or not subject to patient's consent? Will there be an obligatory information of patients, or also do the patients have possibility to object to the use of artificial intelligence? Also still open issues and open for discussions. So last words, many things are still quite open. Thank you very much.
Thank you very much for attention.
Thank you both for your presentation and for your insights in the practice.